Thank you, Chris. And again, thank you, members of the media, for helping us to get our message out. As you can see, we are completely virtual this time. We are not in the same room, though we have the same background. And partly that's due in order to continue to protect us as well as those around us during this unprecedented surge due to Omicron. I'll start off with numbers like we always do. As of this morning, we have 92 total inpatients across our health system, one of those at Acadia Hospital, 5 at A.R. Gould Hospital, 53 at Eastern Maine Medical Center, 4 at Inland Hospital, 8 at Maine Coast Hospital, 3 at Mayo Hospital, 15 at Mercy Hospital, and 3 at Sebasticook Valley. In addition to that, we are taking care of 17 patients at home who are positive for COVID-19 through our home care and hospice service. Our 2-week positivity rate is now 26.81%, and our 1-week positivity rate is 27.7%. The continued rise in positivity rate indicates that COVID-19 is more prevalent than ever in our communities and speaks to the needs to get vaccinated and boosted, wear a mask in public, stay home if you're sick, and continue all the other healthy behaviors that can make a difference. We also have available our most recent COVID-19 hospitalization graphic. The numbers continue to show that those who are vaccinated have lower cases of hospitalizations and severe illness. However, we are seeing an increased number of breakthrough cases. Thankfully, many of those needing admissions are recovering faster than we see in those who have not yet been vaccinated. This increase highlights the infectious nature of the Omicron variant, but shows that vaccination, especially when boosted, limits more severe disease. As we've noted before, this graphic represents a snapshot in time, and the data is constantly changing. The graphic, which is included, has data compiled from this morning and will be shared in the chat. And with that, I'll turn it over to Paul for some updates on staffing.
Thanks, Dr. Jarvis. As of yesterday, Northern Light had approximately 575 employees out of work due to COVID infection or exposure. Because of this, staffing continues to be tight around the state. Both clinical and non-clinical staff throughout the system continue to go above and beyond to care for our patients during the most challenging times during this pandemic. We're certainly proud and thankful of their work and commitment to our patients. And at last week's briefing, we shared that we had activated contingency staffing at 5 of our hospitals. And as a reminder, under contingency staffing, the quarantine period for a positive employee is 5 days, and they would return to work with a negative test if they are asymptomatic or mildly symptomatic with improving conditions. And right now, contingency staffing is in place at all Northern Light facilities. But to be clear, under contingency staffing, our staff are testing negative before they are permitted to work. We do not have COVID-19 positive staff working in our facilities, caring for our patients, or in our facilities in other capacities as well. And with that, I turn it over to Suzanne.
Great, thank you. I just want to take a little bit of your time this morning and talk about masks. So guidelines for mask wearing have changed throughout the pandemic, and which is really no surprise. As the pandemic evolves and newer variants like Omicron circulate, guidance around mask using has changed as well, and that's really to be expected. The most important thing to know is that any mask is better than no mask. All masks provide some level of protection. So when you're indoors around anyone that is not a member of your immediate household, you should wear a mask. The CDC guidance on mask wearing was recently updated to note that people should wear the most protective mask that fits well, that they're able to wear consistently. In the community, people may choose to wear an N95 or KN95 respirator, which if they fit properly and do not have an exhalation valve, can provide great protection both to the wearer and to those around them. These masks provide the highest level of protection provided they are worn properly. It's important for respirators to form a seal around the face. KN95 respirators are often designed to meet international standards, and they do vary in quality. The CDC website has a lot of great information about what to look for in both N95 and KN95 masks and how to ensure that they properly fit. Additionally, well-fitting medical grade disposable procedure masks, these are often called surgical masks, also provide a high level of filtration if they're worn correctly. In the community, there is a wide variety of masks that look like medical grade masks that are available, but not all meet the same standards as a medical grade mask, and they're not all made the same. It's hard to identify which disposable mask meets those stringent standards. So really make sure that you're looking at the package before purchasing. When disposable masks are used, they should fit securely across the nose, go underneath the chin, and then they're snug along the cheeks. Cloth masks provide less protection against the Omicron variant, but they're still better than wearing no mask at all. For a better fit, some people may choose to wear a cloth mask over surgical mask just to make sure that that surgical mask fits securely. Updating guidelines to reflect this new phase of the pandemic ensures that we're using masks as effectively as possible. If you haven't read the latest guidance that the CDC has released on January 14th, please consider to do so. Thank you.
Thanks, Suzanne. I'd like to end the update portion of today's briefing with some reminders that may be helpful as the Omicron variant cases continue to rise in Maine. The at-home tests for COVID-19 are largely effective, and if you test positive, there is no need to go to a community testing site, emergency room, or urgent care or walk-in care location to confirm test results. Stay home and follow the CDC guidelines for isolation and quarantine. This will keep healthcare services, which are stretched thin, available to those who most need them. Of course, if symptoms worsen or you're experiencing a medical emergency, seek help immediately. If you are being asked to retest for COVID-19 before returning to work or school, please use a rapid antigen test and not a PCR test. PCR tests have a very high level of sensitivity and may produce a positive test for as many as 90 days after infection. Due to demand, the turnaround time for these tests can be as many as 4 days. It is important to reserve this testing capacity for diagnosing illness. Antigen tests can be purchased at pharmacies and are eligible for reimbursement from your insurance provider. The U.S. government is also piloting a program to send free tests directly to people at home. You can sign up for these free tests at covidtests.gov. That's covidtests.gov. The single most important thing that you can do to protect yourself if you are already vaccinated is to get boosted if you haven't done so already. Visit northernlighthealth.org to make an appointment at one of our many vaccination locations across Maine. These sites also provide vaccines to those who are not yet vaccinated. Vaccination continues to be available at no out-of-pocket cost to everyone. And with that, we'll turn it over to Chris to start our question portion of the briefing.
Thank you very much, Dr. Jarvis, Paul, and Suzanne. So we're going to start the questions, and we'll start with WABI Owen Kingsley. Owen, we're going to give you the opportunity to ask your questions in a second. For members of the media, let us know who you'd like to direct your question to. For a reminder, Dr. Jarvis certainly can answer anything related to medical questions in our medical response. Paul certainly can address issues such as staffing, and Suzanne is well versed in infection prevention. So, and if you don't know who to direct your question at, we can certainly figure that out for you. Owen, you're up.
Thank you very much. Dr. Jarvis, I'll start it off with you. I was going to ask this, but you decided to end off talking about the at-home COVID test. So I'll just simply start off with what kind of difference is this accessibility and availability of at-home tests going to make to, or what kind of difference will this make to Maine people who say they are having a hard time trying to get tested?
Yeah, this can be a game changer for us because it will make the availability of home tests more for everyone. As long as people do go ahead and sign up and get those done. We also expect influxes into the state for commercial purchase as well. And so I think, more availability is good news. This is for a couple of reasons. One, because if somebody starts to have mild symptoms, they can test themselves and therefore know whether they need to quarantine and how they can protect their families and the community. It'll also help because our testing sites right now are being overwhelmed. Right now, we are seeing record numbers of individuals who need to get tested, and that's resulting in delays in test results getting back because of the sheer volume that have to be processed. And it's also creating unnecessary long lines at our testing locations. So if we can help to limit the amount of people being tested for mild symptoms, that will help us to continue to test for more critical diagnostic reasons, and also to help with all the other pre-testing that we have been doing. So all of those things can help conserve some of our resources. It'll also help keep people out of our emergency rooms, out of our walk-in care, so they can continue to treat those patients that need to be seen in those particular areas.
A follow-up to that question, Dr. Jarvis. Thousands of Mainers are about to have these at-home tests in their home. learning how to use them and relying on them to help know how they should be behaving if they test positive or negative. You were just saying that if you test positive, you should take it as a positive test. If you test negative, what are you recommending to people? What actions should they take at that point?
Well, I think if they've just started to have symptoms, they may want to at least isolate for a couple more days. If their symptoms begin to get worse, then I think definitely consider taking another test. If their symptoms improve, it's probably one of the other respiratory viruses that are out there. Unfortunately, this is cold and flu season, and so there are other respiratory viruses out there besides coronavirus, or the virus that causes COVID-19. And these tests are only testing for COVID-19. So it's probably more likely that if your symptoms are improving, that you're probably not infected with COVID if you had that negative test. They are fairly accurate in symptomatic individuals, and so we're pretty comfortable with that for when it is a symptomatic individual. One word of caution I do want to state is that we know that many people are trying to buy these tests online, and unless it's from a reputable source with a reputable test that has EUA authorization or the FDA authorization, be wary of those tests. Unfortunately, we do know that there are people out there who will try to make money off of any crisis, and that they are selling tests that have not been proven to be accurate. And so be very cautious about purchasing them online. This system that the federal government set up, two things that are good about it: one, it's free, and two, the tests that will be coming will be tests that we recognize as tests that are valid.
Thank you very much for your questions, Owen. Next up is Corey Bouchard.
Thank you, Chris, and thank you, Dr. Jarvis, and everyone there. My first question is either for Dr. Jarvis or Suzanne, and it has to do with the N95 masks. President Biden did announce this morning that they'll be distributing 400 million, I believe, masks through pharmacies and community hospitals. I was wondering if Northern Light Health, all the Northern Light Health facilities will be participating in that.
Yeah, I can take that one. We're excited that this extra level of protection is going to be provided to the public very soon. Unfortunately, we do not have details right now about how the program will work or what our role as Northern Light will be in the distribution plan at this time. As soon as we know more, we will certainly share it. We do want to remind our communities that while verified N95 and KN95 masks provide additional protection against the Omicron variant, it's still a well-fitted and appropriately sourced surgical mask can help with the prevention of the spread of COVID-19. So the most important thing is just to make sure that everybody is wearing a well-fitted mask consistently when they're out and about.
Absolutely. And my second question has to do again with masks there. It's, why is the CDC updating the guidance now when it comes to, N95, KN95? Why are they recommending that now as opposed to earlier in the pandemic when maybe it could have helped a little bit more?
And while I can't speak specifically to why the change was today and not earlier in the pandemic, what we have found is there's such a wide variance of masks that are out in the market that by suggesting that people wear this higher level of protection, it's providing better guidance. Initially, there was supply chain constraints. A lot of those supply constraints have now softened a little bit, and we're able to get a better source. So we're able to provide not only to our healthcare workers where it's critical that they have N95 and respirator level of protection, we're now able to, as a country, able to source additional respiratory protection for our communities as well.
Thank you for your questions, Corey. Next up is going to be Nora from WMTW. Nora, you should have the ability to unmute yourself.
Thank you. Yeah, it wasn't working initially, but it looks like you just gave me the permission to do that. So thank you. This question is directed at Paul. If we could just go back to that contingency staffing that you discussed at the top of the call, would you mind giving us a little bit more in terms of specifics what the protocol is once a staff member does either show symptoms or get a positive COVID test, where you go from there before you hit that 5-day quarantine reevaluation.
Sure, absolutely. And so, and I'll have Suzanne chime in if there's anything that I miss. She's our infection prevention expert, and so I will defer to her on any clinical matters that I missed. But when an employee tests positive for COVID, they're removed from work and would need to quarantine for 5 days. And it could be longer if their symptoms persist. But if they have symptoms that have dissipated, so they're asymptomatic, or their symptoms are lessening and no new symptoms have developed, then they'd be allowed to return to work after 5 days. So on day 6, they could come back to work. And again, it's all case dependent, because those employees who continue to have symptoms or have symptoms that get worse certainly would not be able to return. And so it's a similar approach that schools and other institutions would use in terms of returning people back to work when they're asymptomatic or have improving symptoms.
Anything you'd like to add to that, Suzanne, or is that?
Yeah, and in addition to that, our employees that are symptomatic and had previously tested positive, we're taking that added measure to have them test negative if they're coming back anything earlier than what was our previously standard of 10 days. So we've taken that added protection just to ensure the safety of our staff and patients.
Okay, thank you for that. Do you have a follow-up question, Nora?
I have a second question, if that's all right. And
Sure.
Suzanne, I think you might be best suited to answer this. In terms of the masking for the community in general, before they have access to those masks that are going to be distributed from our federal government, how do you recommend that people ensure that if they are spending money on those N95s and KN95s, where should they be going to ensure that they're not getting counterfeit masks?
I highly recommend that if somebody is not sure about what they're purchasing, to go to the CDC website. It lists all approved, both KN95s and N95s that have been vetted. So that way you can take a look at who the manufacturer is and the model number. So that way, if somebody's not sure, they have a source that's kind of the source of truth for all of that, which is certainly the CDC. And again, the most important thing is for the wearer to find a mask that they can wear consistently throughout the entire duration that they're out in public.
Okay, thank you for your questions, Nora. Next up, we're going to go to the Ellsworth American, Rebecca Alley.
Great, thank you all for your time. Dr. Jarvis, this is something I brought up a few briefings ago, but it's something that our readers keep asking. We've had a few residents that report that they or loved ones have had to spend hours in their cars awaiting medical care at Maine Coast Hospital because they were either COVID positive or awaiting test results. So we're just trying to understand the process there, and can you speak to what circumstances would require someone to wait in their car?
Yeah, it really comes down to what space is available for us to have people inside the buildings, and what risk that we can mitigate by limiting the number of people that are going in and out of the facility, particularly those that either are known to be positive or suspected to be positive. This really highlights the critical situation we're seeing across Maine and across the entire United States, where unfortunately bed space, both in our emergency departments and in our hospitals, is very, very limited due to the high volume of people who need our care right now, and then trying to protect everybody at once. Suzanne may have some more specifics than that.
Yeah, the only thing I can really add is there are occasions where we may ask patients to wait in their car, but it's specifically around trying to make accommodations so we can bring them in safely to protect both staff and other patients. So we're just making those safety accommodations. It certainly should not be any long period of time that anybody's requested to wait. And that, again, it's around safety.
Yeah, and we certainly feel for these kind of situations when they arise, and we struggle with them day in and day out, trying to accommodate all the patients that need our services. Unfortunately, again, as I said, capacity around the state is extremely limited. We have many individuals who currently are waiting in emergency departments to be transferred to a higher level of care at a place such as Eastern Maine Medical Center. And so we know that those wait times are there. We know that that's happening. We wish every patient could be seen in the right place at the right time for the right reasons, but unfortunately, that's just not possible now with the tremendous number of patients that we have to care for right now acutely.
You have a follow-up, Rebecca?
I don't, thank you.
Okay, thank you, Rebecca. Next up, we're going to go to Eric Russell with Portland Press Herald.
Thank you all for taking the time. Two questions. I think the first one's for Paul. Can you provide an update on what kind of assistance the National Guard members are providing and are expected to provide? I think you're going to be getting some folks either later this week. Is that right? I don't know, give us an update on that.
Yes, that's right. We're expecting additional National Guard members to join us in helping to support this effort, and the National Guard will be providing assistance in terms of providing one-to-one observation sitters for some patient care needs to free up clinical staff to continue to meet their duties and obligations to other patients. And so that will be a big help, especially at EMMC, where that need is the most acute.
And this question is for Dr. Jarvis. Are you able to give us an assessment of the severity of symptoms? I know overall we're seeing hospitalizations go up significantly in the state, but the number of people requiring critical care or ventilators even has actually leveled off or even come down in some cases, even as those overall hospitalizations are going up. So, I mean, I think there's some evidence that the Omicron variant might be less severe for some people, but maybe you can expand on that a little bit from what you guys are seeing.
So Eric, we're seeing that is exactly what we are seeing. You know, hospitalizations across the state have been increasing as far as COVID-19 goes. Northern Light Health hit a record last week in the number of patients, total patients admitted across all of our hospitals, and so that is certainly concerning. Thankfully, many of these individuals have more moderate disease, so they still require hospitalization, but they're not requiring intensive care and not requiring ventilatory support like we had seen with the Delta variant. So that is good news for us. The problem is the Omicron variant is so infectious, it's infecting so many more people that there's always still going to be some people that require hospitalizations and unfortunately have severe illness that requires intensive care. So it's really a volume issue there. The more people that get infected, we are still seeing those hospitalizations continue to rise. And so that's the concern. We do know that people who are fully vaccinated and who have received their booster shot are far less likely to be hospitalized. And if they do get a breakthrough case, that their symptoms are milder, and even if they require hospitalizations, they are far less likely to require intensive care or ventilation. And so therefore, again, it's one more just a data point for us to say it's important for people to get vaccinated, and if you are vaccinated, to get boosted, because that will help to limit the likelihood of you needing to be hospitalized or wind up in one of our intensive care units. So thanks for the ability for us to remind people of that.
Thank you very much, Eric. Next up, we have Stephen Armstrong from News Center, Maine.
Hi there, and I'm kind of in the same vein. I kind of wanted to know, for example, we had someone this morning email us just kind of questioning, the vaccination status of people who are hospitalized and things like that, and just kind of doing a quick tally with your numbers in this from the graphic you provided. It definitely seems like there are more breakthrough cases. So, what would you say to someone who is kind of of that opinion that, well, this is Omicron, it's not as severe, I'm not vaccinated, but I don't care, I'm just going to get it and get it over and done with. It's not as severe an illness. What would you say to a person who's of that kind of mindset, who's saying,
Yeah. What I would say to them is, unfortunately, we're still seeing people hospitalized and unfortunately still seeing people die from COVID-19 and from the Omicron variant. So it is still a deadly virus. It is great news that it is less virulent than we've seen with other variants, but that does not make it any less of a concern for us. I will remind people that, yes, we are seeing more breakthrough cases. It certainly is a result of the more infectious variant of Omicron. But If you look at those numbers, still, the majority of people hospitalized across Northern Light Health are unvaccinated. Remember that right now, about less than 30% of the population in Maine is unvaccinated. Therefore, that's a much smaller pool than the vaccinated pool. And so just looking at those numbers, we would expect that if vaccines weren't working or they were not effective against Omicron, that our vaccinated numbers would exceed our unvaccinated numbers simply because there's more people. But that's not the case. It continues to be this way. And then if we really dive down into those with severe illness, if we look at those who are in our intensive care unit and those who are on ventilators, the overwhelming majority, 70% of them, are people who have not been vaccinated. So vaccinations work. This is another thing that shows us that they do, because otherwise we would see far more breakthrough cases than we are right now. It's a much bigger population, and yet they are less likely to get sick.
And do you have a follow-up question, Stephen? Oh, I see you muted yourself. Hold on, Stephen. Let me unmute you so you can let me know.
There we go. Muted too early. Yeah, just I'm just on the contingency staffing plans that you mentioned, Paul. Sort of just from a general perspective, how close are you to needing to activate that measure, and what kind of pushes us in that direction, and what would that look like if it has to happen?
Sure. And so to be clear, contingency staffing, which is where our hospitals are currently at, does not have a provision to allow any COVID positive employees to be working in our facilities. We're at contingency staffing. Some people confuse that with crisis staffing or say them together. Crisis staffing is altogether a much more serious circumstance that we have been fortunate to avoid up to this point, and we hope to continue to avoid it. Crisis staffing is the staffing at which the possibility is there that facilities could be in a position to consider using COVID positive employees as part of their workforce in certain areas. We have not gone to that, and we hope to avoid that on an ongoing basis.
David, I'm sorry, I guess I was on mute too. David, you should have the ability to unmute yourself right now.
I do, thanks. So my first question is for Dr. Jarvis. Walgreens said today that they have this data from 49 of 50 states. North Dakota is the only one that's not included, showing the rate of Delta, Omicron cases, and I guess maybe a few Alpha cases, but I don't think so. But anyway, 44% of cases in Maine are Delta, which is by far the highest in the United States. The next highest was Kansas, which was 37. Why would Maine have so many Delta cases at this point? Can you think of any reason why? Because I was trying to figure out myself.
Yeah, so David, it's probably multifactorial. The first and foremost is, remember, Maine usually lags behind the rest of the country when it comes to any kind of respiratory illness, and we have seen that during this entire pandemic when it comes to coronavirus. Typically, we can start looking, at Europe and then the rest of the country before we start looking at things that happen here, and so there is a little bit of a lag time. It may also due to the fact that we did have some significant outbreaks right around the holidays into the new year around Delta, with the Delta variant in some specific places around the state. And then lastly, it could also do with the geography. Walgreens does not permeate to every single aspect of the state of Maine, and so it may be some calculations there that they have. We are pretty sure, though, that Omicron is by far the most widely spread variant that we are seeing right now, and it certainly appears that way both from a symptom standpoint and from what we're seeing in our hospitals.
And David, I believe you have a follow-up question.
Yes, I do. And this one would go for Suzanne. The 1,545 cases today is actually 10 down from Thursdays, basically statistically the same. Do you see cases, any kind of trends in cases right now? Is plateauing, or are they seem to be going down? Or are they very clearly going up? What is your, what is your read on it?
As of this point, we're very encouraged by what we're seeing. However, it's really too early to say if we've hit that plateau yet. I think we still need a couple more weeks to see if our case rate will start to cycle back up again, or if this truly is a plateau and it starts to trend its way down. As Dr. Jarvis mentioned, we were a little bit later than some of the other states in seeing this variant come within Maine. So our data tends to lag a little bit as well.
Okay, thank you for your questions, David. Last but not least, we have Patty White from Maine Public.
Thank you. This question is for Dr. Jarvis. Dr. Jarvis, you told my colleague Jen Rooks this morning that you've had to curtail services and close beds. Can you just tell us, because of the surge of patients and all the staff who are out sick, can you tell us what services you're curtailing at this point and how many beds you've had to close?
Yeah, so of course it varies not only day to day, but almost minute to minute. Unfortunately, this week, Eastern Maine Medical Center did have to close a significant number of medical surgical beds and intensive care beds. And of course, as the region's tertiary care center, that becomes problematic, in a downstream effect. They're doing everything they can to reopen those beds in a timely fashion and get patients in as they need to. As far as curtailing services, there's no one thing that we are curtailing. It is really more of looking at what we can handle today at this time. And so sometimes that has required us to delay some non-time sensitive procedures. And that continues to this day. And that's happened at various member organizations across our system. Again, it is not any one thing that we've said we've had to stop doing. It is really looking at what we can do right now in the moment with the services that we can provide. And so it's not anything there's no one particular thing, but it does become part of that looking at the situation that we're in right now, which is still very, very fluid. And at one moment, we may have this number of patients and can accommodate some other patients, and in a very short amount of time, see our hospital beds filled up. That actually happened yesterday, where earlier in the day, it looked like we were going to have at least a few beds open, and within just a few hours, all of the beds that were available to us were filled. So it's a very fluid, dynamic situation.
Okay, thanks. And you also mentioned that you've got 33 people from smaller hospitals who need to be moved for a higher level of care. That's a snapshot also. How does that compare, to, recent days and weeks, that 33 number?
Yeah, well, we've seen that number balloon up into the 50s at some times, but typically, for the last month or so, somewhere in the 30s seems to be what we're at. Unfortunately, it's the conditions of those individuals. It's not uncommon for the medical centers across the state to have some people waiting out in the region to need their care, but they don't have anything urgent that needs to be done now. The concern now is that we are starting to see more urgent cases who we do not have bed space for at any of our tertiary care facilities across the state. Just a couple of weeks ago, we had a case where in all of New England, there were no neurosurgical ICU beds available in all of New England. So not just Maine, but we're talking about big cities like Boston not being able to accommodate patients. That's the real reality of what we're dealing with, that at any given time, if your family member or you need a critical care bed, it may not be available to you, or its availability may be miles and hours away. And that's the reason why we have our continued plea: get vaccinated, wear your mask, wash your hands, and stay home when you're not feeling well.
Well, I think that wraps up our list of questions for members of the media. I thank you again for joining us today. A reminder, if you had any trouble with your recordings, shoot us an email. We've also made a recording that we can share with you. We thank you for your time today, and thank you, Paul, Dr. Jarvis, and Suzanne. And if you have any closing thoughts, the floor is yours.
Thank you, everybody. Again, we see you as a partner with us, and we appreciate you getting our message out.
Thank you.
Thank you.
Have a good day, all.